you, Madam Chair, and thank you to Ranking Member Capito. Congratulations to both of you on your new roles on this subcommittee, and it's nice to have the Vice Chair of the Appropriations Committee here as well, and the Chair with Senator Murray, so thank you all. Secretary Becerra, thank you for being here and for your testimony this afternoon. I wanted to ask you about insulin because it's something that Senators Collins and I have been very concerned about as the co-chairs of Diabetes Caucus in the Senate. And as you know, last session of Congress, we put a $35 cap for Medicare beneficiaries on out-of-pocket costs for insulin. Do we have any data yet that shows what the impact of that has been? And can you also address why that's not enough, why we still need additional action on insulin affordability?
We're beginning to collect the data, Senator, and what I can tell you is the stories I'm hearing, the anecdotal stories from actual insulin users is perhaps the best evidence when they find out that they only have to pay $35. I had a woman, I believe it was, I'm going to get this wrong because I've been to many states, North Carolina, I believe. She was shocked when she only paid $35. She was accustomed to paying about $117 for her insulin for the month. She went back to the insurer and said, I think I owe you some money. And she had to be told, no, that's the cost now, because in December she had paid the higher price. In January, all of a sudden, magically, it was lower. It's affecting a lot of folks. But in your state of New Hampshire, this is probably going to add up for this year, for someone on insulin on Medicare, to about $536 that they will get to keep in their pocket.
Well, that's very good news. And I assume that long-term, it's also going to be helpful in terms of the costs of treating diabetes, because if people are able to get their insulin without having to worry about episodes that would put them in the hospital, in the long term it's going to save the system money. Do we have any of that data yet, and are we collecting it?
Oh, we absolutely do, because we know people ration their insulin to make it last for the month. We know that people will skip their insulin shots because they don't have enough to last them for the month. That changes now, because now it's only $35 for the full month. And as you know, the President in his State of the Union address said, it's great that this is available to the 67 million people on Medicare, but what about the rest of America? And today, the 3 largest manufacturers of insulin have agreed that they will drop their prices of insulin, and this is a result of the Inflation Reduction Act that you all passed and the limits you put on insulin.
And I think that's very good news. I am not confident, however, that that's going to address the problem that everybody's facing, so I think we still need further government action on that to make sure that everybody has those out-of-pocket expenses capped in a way that ensures they can get access to insulin. One of the other issues that we're very concerned about in New Hampshire is the opioid epidemic, which because of fentanyl has gotten exponentially worse. And as you know, the state opioid response grants are particularly important to states across this country. As you and SAMHSA continue your work on the SOR allocation formulas, can you commit to working with my office, with Chair Baldwin, who I know is concerned about this because she and I worked on ensuring that SAMHSA is looking at the cliff that states might be facing if those opioid response grants got reduced dramatically?
Senator, the President in his budget calls for $2 billion to go to SOR grants because they've been effective, and we don't want to find that a center can provide services for 5 months out of the year but has to close down after May, or that they can't reopen during the hours of the day when people come most. And so what we're finding is that we have to work hard to make sure that states can keep people coming, believing that this is going to be a continuation of service, so they will take advantage of it. And so we look forward to working with you and your colleagues to make sure that we make this work right, and that no state finds that it's running out of money at the wrong time and faces a cliff of funding when they need it most.
And Senator Capito and I worked on legislation to try and encourage providers to prescribe non-opioid Pain. Well, for pain, but we're not talking about medications. If they're non-opioids, we would be talking about devices or something else. Can you talk about what you can do as a department to try and encourage providers to look at something other than opioids when they're prescribing for pain?
Yeah, and that's where we would turn to the best practices, where the evidence shows that they're effective. The FDA would be the agency that would make sure that a particular device or medication would be safe and effective for use. And I think a lot of us understand that we need to find other ways to provide pain therapy so that no one feels like they have to get on these very addictive medications like opioids in order to be able to survive the pain that they face.
Well, thank you. Thank you, Madam Chair, and I would encourage the department to think about ways in which they can make sure that providers understand that there are other alternatives other than opioids.
Yes.